This wheel is the difference between practitioners that consistently get great results for their clients and those which don't. This blood work wheel is something what we've created, and it encompasses just some of the patterns you can identify when it comes to blood work. And you can actually see how this works. It works with multiple levels. We can see at the start, it's just a simple wheel, and at the center, it's almost like a key, right? So you look up at the start and you start with quality control and you work round clockwise, because each pattern here is done in a sequential, chronological order of how the body is designed to respond and function. Which means if you, let's just say, have an issue with candida down here, and we also have multiple issues coming up, we can see that there's issues with maybe consuming too much fat, maybe issues with protein putrefaction, maybe there's issues with H. pylori, low stomach acid. We know that if we overlook these foundational layers, we are going to get very poor results when it comes to actually addressing this candida, because we need to make sure that the body's ability to digest the foods isn't creating downstream issues. And again, it isn't just limited to candida, right? We can go all the way across over here to almost at the end of this process, and we can look into female hormones, and we can see that, hey, for things like pregnancy, that if someone has any thyroid issues and we're ignoring that, if there's even blood sugar issues, or if there's anything to do with their stress all the way over here, they're going to have a hard time when it comes to fertility. So this blood work wheel tells you specifically what you need to address in the right order to create a root cause solution for long-term results. And we can see that when we zoom out even further, there is sequential chunks to this. Like obviously we have to start with quality control. We have to make sure that the data, what you look at, is actually viable. Then we look into stress, then we look into dietary, we look into upper GI, we look into micronutrients. All of those represent the first layer of approach, which is nourish. As we go through, we then have to look into restoring. We look into restoring barrier integrity, and we look into restoring elimination, which is the phase 2 elimination process pathways. Then we move to the third layer, which is defend. And this is when we look into things like immune function, mycotoxins, parasites, you name it, anything which is a pathogen, a threat to our immune system, we have to address. Then we can go to the fourth layer where we're looking to regulate. And this is where we regulate blood sugar, thyroid function, and last but not least, this is where we can look into optimizing hormones. You have to work with the human body in this way. You can't just look at the symptom and try to attack the symptom head on. You have to actually understand how we've been designed, how we have evolved, how the body actually works in order to work with your clients, not against them.